Experts are comparing this trial to those brought against big tobacco now in the 1990s. It's that big. Tobacco companies were accused of marketing their products to young people. A settlement was reached after evidence came out that big tobacco knew its products were addictive and dangerous. Some fear social media companies are taking a similar path, drawing in youth with addictive algorithms and features. Dr. Daniel Bober is a psychiatrist and the chief medical officer at Odyssey Behavioral Healthcare. He's also a certified addiction medicine physician. Thank you for joining us. I mean, what do you think about the comparison to big tobacco? It's almost as if the media companies have got that in mind, because they're saying they're deliberately not marketing to young people now. They're preventing them from getting on the site as much as they can if they're seeing harmful material.
Well, you know, Max, I think big tobacco is actually an excellent analogy. This case is not about willpower. It's about apps that are designed to overpower it. And we don't need a diagnosis to know that there is a problem. If you think of the human brain, especially in children, you can think of it as a car, right? You have the limbic system, which is the reward system, and that's the gas. And you have something called the prefrontal cortex, which is the brakes. So in children, you have all gas and almost no brakes. So for these companies to say that we should be using parental controls and that's going to save us is like giving someone a car that has no brakes and throwing in a helmet. So there has to be some sense of corporate responsibility and a commitment to public health to protect children. And I don't think we're seeing it here.
I mean, responsibility is key here, isn't it? Whilst there may be, evidence of addiction, how responsible is the company for that? How responsible is the user? How responsible are the parents?
Well, listen, I think we all have to pitch in. We all have to contribute. We child-proof medicine bottles. We child-proof toys. We child-proof car seats. This is really about common sense regulation. Sure, the parents play a role, and I can tell you as a child psychiatrist, I see a lot of parents who aren't using the parental controls. But there's a lot these companies can do. They can turn off autoplay. They can turn off infinite scrolling. There can be hard endpoints, time limits, no push alerts after a certain time at night. These kids are sleep deprived, and sleep is critical for kids for their mental health in terms of emotional regulation and learning. So all these things are things that we can do to be more responsible and to protect children because these apps are like oxygen. Over 90% of children are using them, and we need to be thinking on the level of public health.
Australia is an interesting example, isn't it? They've banned it for under 16s, and there's been lots of suggestion, anecdotal suggestion, that it's been good for kids, but there's also been lots of evidence that they found ways around the ban and still managed to get on social media. But what do you think we can, this case can learn from what's happening in Australia?
Listen, I don't doubt that kids will find a way. They always find a way. They're very resourceful. And I actually, as a child psychiatrist, maybe my perception is a little bit skewed, but I don't think that it's been good for kids. I think it's been a menace for kids' mental health, especially kids who are already suffering from problems with depression, anxiety, body image. But I think that these companies will just at least meet us halfway and change these behavioral algorithms so they're not so engaging and so reinforcing. I think everyone can enjoy the benefits without suffering the harms.
Do you see some benefits of social media? There's been a lot of commentary in Australia, for example, that insular children have managed to find communities on there, and that's been taken away from them, and that's been harmful.
I do see benefit. And to be clear, no one is saying that these apps cause mental illness, but it's sort of the fuel that's on the fire. And in kids who are already vulnerable, it is definitely contributing to it. And I do think there are some benefits. I think in a lot of ways it does improve social connection and improve the cohesiveness of communities. So it's not all bad. It's not black and white. But we need to do better, and these companies need to do better.
Dr. Daniel Bober, you'll be watching the case closely, as will we. Thank you so much for joining us.